This training will cover Chapter 1, General Requirements and Administrative Oversight. This video is presented by the Oregon Department of Education Child Nutrition Programs, also known as ODE-CMP. In this training, we will cover CACFP federal regulations, meal pattern requirements, record-keeping requirements, health and safety requirements, and administrative oversight. Once you are done with this training, you will know the basis of CACFP requirements, meaning that you will know what the CACFP requirements are based on and gain a broad understanding of the general requirements of CACFP. CACFP requirements are based on the CACFP federal regulations under the Code of Federal Regulations. The main code is under Title VII, Part 226, often shortened to 7 CFR 226. This section covers the Child and Adult Care Food Program. The regulations in this section are based on Section 17 of the Richard B. Russell National School Lunch Act and covers the requirements of CACFP for both state agencies and the sponsors that operate the program. In addition, CACFP regulations also follow Title II, Part 200, also known as 2 CFR 200. This covers uniform administrative requirements, cost principles, and audit requirements for all federal awards, and in CACFP we cover it all under procurement requirements. Sponsors who want a deeper understanding of these rules are encouraged to check out the electronic CFRs online. Links to these CFRs are available in the description section below and also in the CACFP Policy and Procedure Manual. These regulations are important to understand due to how they shape the CACFP requirements that sponsors must follow. This includes the meal pattern requirements for CACFP. The CACFP was set up to help sponsors serve nutritious meals to eligible participants. To ensure that the meals are healthy, there are meal patterns that must be followed, and they are broken up into 3 major age groups: infants, children, and adults. These meals and snacks are then reimbursed based on whether they meet eligibility requirements set out in the CACFP regulations. The meal patterns for infants cover the 0 to 11 month age range. The child meal pattern covers the 1 to 18-year-old age range and can also be broken out further into the 1 to 12 age group and the 13 to 18 age group. The adult meal pattern covers those who are 60 years old and older or functionally impaired. Additional information on meal patterns will be covered extensively in the videos for Chapters 9, 10, 11, and 21. Chapter 9 covers the child meal pattern and provides in-depth guidance on CACFP meal pattern requirements. Chapter 10 covers meal service requirements and menu records. Chapter 11 covers the infant meal pattern. And Chapter 21 covers adult daycare requirements in general and includes a training specifically on the adult meal pattern. Meals and snacks that are reimbursable include breakfast, AM snack, lunch, PM snack, supper, and evening snacks. All meals and snacks must be approved by ODE and served during the sponsor's operational hours. While sponsors may serve some or all of the meals and snacks listed, only a maximum of 2 meals and 1 snack or 2 snacks and 1 meal may be claimed for reimbursement per child per day. For example, a childcare site that offers breakfast, AM snack, lunch, and PM snack can only claim the breakfast, lunch, and 1 of the snacks per child each day. There are different maximum number of meals and snacks that can be claimed for at-risk after-school sites and emergency shelters. Check out the videos in Chapter 16 for at-risk after-school requirements and Chapter 17 for emergency shelters. Here's a quick knowledge check. What is the maximum number of meals and snacks that can be claimed by a sponsor in CACFP? Is it 1 meal and 1 snack, 2 meals and 1 snack, 3 meals and 1 snack, or 3 meals and 2 snacks? The answer is 2 meals and 1 snack. Sponsors can also claim up to 2 snacks and 1 meal. Remember that all meals and snacks must be approved by ODE-CMP first. All CACFP sponsors are required to keep records to support these regulatory requirements laid out in 7 CFR 226. All the required records must be maintained for 3 years plus the current program year. Program years are also often called fiscal years, and they run from October through September of the following year. There are a variety of records that are required, but here are the basic records that are required for all programs. This includes financial management documentation showing that nonprofit food service requirements are met, daily point of service meal counts, daily attendance records, menus and their supporting documentations, and civil rights documentation. More information about each of these records will be included in additional chapters. There are some records that are required for certain sponsor types and certain circumstances. These include confidential income statements, also called CIS, child enrollment forms, also called CEF, 1-month enrollment roster, also called OMER, medical statements and meal preference request forms, daily infant menu records, for-profit eligibility documentation, and more. For sponsors who are new to CACFP and for new sponsor staff who are learning about CACFP, ODE-CMP will assign the relevant chapters that will cover the required documentation for your site type. Here's another knowledge check. How long must all CACFP records be maintained? Is it 1 year plus the current program year, 3 years, 3 years plus the current program year, or 7 years? And the answer is 3 years plus the current program year. This means that if you are currently in April 2025, you can get rid of records prior to fiscal year 2021. All CACFP sponsors have the responsibility to protect the health and safety of those in their care. CACFP has health and safety requirements that sponsors must follow. This includes notifying appropriate licensing and health authorities of conduct or conditions that pose an imminent threat to the health or safety of their participants or to the public. Ultimately, sponsors bear the responsibility of meeting all CACFP requirements at their sites. This oversight and management of the program may not be contracted out. Administrative oversight includes meeting all CACFP requirements, ensuring integrity and accountability at all their sites, maintaining systems of internal control, and identifying and resolving any non-compliance that may crop up. In review, in this training we covered where to find the CACFP federal regulations, the basics of the meal pattern requirements, record-keeping requirements, and health and safety requirements. We also touched on the need for sponsors to maintain administrative oversight. ODE supports equity and excellence for every learner. This institution is an equal opportunity provider. Thank you for taking this training.